Empower Physical Therapy. Our job is keeping you in the game.
Hi, Jeremiah Hales, licensed physical therapist with FitGolfGuy.com. Today I wanted to pair a video on YouTube with a blog article I'm writing right now on hip flexor flexibility in the golf swing. Your hip flexor muscles are really important in playing good golf. If you want to play at your highest level, you need to be able to have flexible hip flexors. And the other thing that I like about making sure people have flexible hip flexors is that it greatly reduces your chance of hurting your back. A lot of golfers experience back pain throughout their golfing career, and it's a big problem. As a clinician working in my physical therapy practice, I treat back pain every day in the golfers that I work with, and my training clients. We're constantly striving to eliminate the risk of back pain from their lives. And one of the big ways we do that is through flexibility. Flexibility is really important. If your hip flexors are tight, they actually yank on your spine, and I'll show you how that works with my spine model. There are three major muscles that comprise the hip flexor muscle group. The first one is called the psoas muscle, and it starts up here on your lumbar spine. This area of your low back is called the lumbar spine. If you look at this model, I'm actually looking at your body from the front. This is the back side where you can see all these little bumps, and then if I flip it around, we obviously have the front side. This is your pelvis, and these are your legs, and your head would rest right up here. So your psoas muscle starts on the front of your lumbar spine. It actually travels through your pelvis to the front of your hip joint and flexes the hip, or it also conversely will bend you over if your feet are flat on the ground. The second muscle is called the iliacus. The iliacus muscle originates inside the pelvis on the front side of the ilia, which is this bone right here, and it goes to the same spot the psoas does. Now the third muscle is called the rectus femoris. It's a big muscle and actually starts right on the tip of the pelvis here on the front of it and goes down to your knee. So three big muscles working hard to either lift your leg or bend you over. And in golf, we spend a lot of time bent over the golf ball. So when we're set up over the ball, both feet are planted on the ground holding the club, and you can see what happens as I address the ball, I bend over at my hip joint. So the hip flexor muscle group is really doing two things. It's flexing the hip joint, keeping it in a nice neutral setup. It's also stabilizing your lumbar spine. Having a flexible hip flexor will also allow you to get your pelvis into a good position. So a lot of you who've been on TPI videos and have gone through golf fitness testing before, there's a pelvic tilting drill where you stand over a golf ball and you kind of tip your pelvis back and forth. When you set up over a golf ball, you want to have your lower abdominal muscles engaged and your pelvis should be tilted back a little bit. That creates space for you to swing your arms through during impact, and it also allows you to maintain good spine angle. The third thing that it does is it helps you generate power by actively engaging your abdominal muscles. So as you can see, the hip flexor muscle group is really kind of central to all of these main issues, and I wanted to share a nice stretch with you today that I think will help you develop better flexibility through your hip flexors and play better golf. So we all have a pillow at home. I thought I'd use a pillow here in the clinic today. You're going to put the pillow on the ground. You're going to kneel on it with your left knee. With your right leg, you're going to position it at kind of a 90-90. So the hip's going to be at 90 degrees, knee's going to be at 90. You're going to take both hands and put them on the front of your left hip, and then you're going to slide forward. If you notice what I do is I keep my chest up. Okay, I'm not bending over. I'm going to keep that chest up, and I'm going to slide out over that right leg as far as I can until I feel a good stretch. I'm going to hold this for 2 minutes. So I'm going to sit out here. I'm just going to hold it. It's a great stretch to do after a round of golf. Certainly, you could always do this before you play golf. And I thought I'd talk a little bit about how hip flexors get tight in the first place. So I've been treating patients and working with golfers for 15 years, and I haven't found very many people doing an evaluation that have flexible hip flexors, just a handful over the last 15 years. And my theory is that when we go to school as kids and as adults, we're sitting most of the day. And that sitting creates tightness in the hip flexors. If you remember from the spine model a few moments ago, those muscles are in the front of the body, and as you're sitting, they get short. And that prolonged shortening during the day, during a day of class, or you're sitting at work for 8 to 10 hours, that chronic short position creates inflexibility, creates tightness, and those muscles start to pull on your spine and create back pain and start to limit you in your golf swing. Now, I've been doing this stretch for a while, felt great. Because I have pretty good flexibility, I'm going to try it a little bit different way. I want you to keep your stomach pulled in. You're going to lean forward, and then I'm going to reach back with that same hand, and I'm going to grab the foot and stretch like that. That's a great way to take the stretch to another level. If you're already pretty flexible, again, you're going to keep your opposite hand on the front of the hip. Stomach is sucked in. You're going to hold this for 1 to 2 minutes. If you have any questions, please comment on the bottom of the video. And if you like it, and remember to subscribe to my channel. I'm having a lot of fun with this, and I hope you guys are too. Have a great day.